9:10 on March 20th, and we have legislative council. We're going to do a walkthrough of S30. So,
Right. Good morning, Jen Carby from the Office of Legislative Counsel. Yes, we're going to do, I'm calling it an overview because it's 180 pages. So I wanted to talk a little bit about how this bill came about and what it is. So we are going to be looking at S30. S30 is an act relating to updating and reorganizing the health insurance statutes in 8 VSA Chapter 107. So the idea behind this, and I worked very closely with DFR, Department of Financial Regulation, they were great. But if you look at 8 VSA Chapter 107 now, which is where all of the health insurance statutes are, they are at this point kind of in no particular order. Long ago, we ran out of new section numbers in there, so many of them are things like 4089, A, B, C, D, E. There's 4100 A through, I think we might be up to L or M at this point. So I was looking to renumber in a way, renumber in a way that made a bit more sense and actually grouped like topics together. So the first thing I'm going to show you is, these are all posted on your committee page. The first thing I'm going to show you is how I organized it because I color coded it. This is apparently these days how my brain works, is everything needs colors.
You're amazing.
So because what I did was I created a chart with the existing, the added columns really was just when I was working on it, but what the topic is kind of in current order. So you can see we go through in current order: 4061, 4062, 4062A, B, C, D, E, F, 4063, etc. And I tried to assign them a color based on where I thought they would go in a reorganized section. So this is the key, is this listing on the first page. So I put them together in kind of general provisions that apply to health insurance generally, policy forms and filing requirements. There's some specific statutes on group coverage. We have a couple of I put these as new subchapters, a couple of subchapters on continuation and conversion of group health insurance policies. This is kind of COBRA and Vermont's version of COBRA. Group health insurance termination and replacement, similar provisions to the extent they're still relevant. Other forms of coverage that isn't just major medical, child and dependent coverage, internal and external reviews, required covered benefits. So these are the insurance mandates to the extent they don't fit into one of these other categories. Prescription drug coverage, prevention and treatment of cancer. Just made sense to kind of put some similar provisions together in their own subchapter. And then service delivery and treatment modalities. And that includes things like where the telehealth and audio only coverage went. So that's how I proposed reorganizing it. And I color coded the list so I could decide where everything went. And that is how and some things have been repealed, so they didn't need to be put into the new chapter. A few things are no longer applicable per DFR, so they did not get included. All right, so that is the first document, just to kind of explain my process. And then the second document, which is what I worked off of for a long time, is a markup. And so what I did here was to be able to show all of the changes from existing law. I went through and put in, first we repeal the existing 8 VSA Chapter 107. And because there isn't really a logical place in Title 8 to put a new health insurance chapter that isn't 107, we're putting in a new Chapter 107. It's just reorganized. So some of the section numbers are getting reused. And then I went through and did it as a markup, like I do when I bring you a bill and show what is different from, in this case, from current law. And I annotated it with if it was a previous section or what's new. So anything that is underlined is new language generally, and occasionally it's just things that have moved. But part of my reason for doing this is that I was trying to be very transparent. And so I wanted, once I had gotten a draft in place with DFR, I wanted it to be able, with the sponsor's permission, to be able to go out to the insurers, to the Office of the Healthcare Advocate, to the Department of Vermont Health Access, to anybody else who might, medical society, the hospital association, anybody who spends a lot of time working in these statutes and would want to have eyes on any potential changes. My point was not to make any policy changes, any substantive changes here, but really just to clarify, to introduce some definitions that would apply across the whole chapter. And that was one of the issues that we found, is that there are many different definitions throughout the chapter and many different terms used to mean the same thing. It was unclear when Medicaid was or was not included. And often Medicaid, when it was included, was described in the definition of a health insurance plan, which is kind of confusing. Really, when we're talking about health insurance, we're talking about what's being offered by the insurer. This is probably phase one of a two-phase process. The second piece that I've talked to DVHA folks about in the past that they would really like is to move all of the Medicaid provisions to Title 33. And I think in my ideal mind, there would be some pointing back and forth between 8 and 33. So you'd know by looking at the health insurance statutes whether Medicaid was implicated, but the actual requirement on Medicaid would go in the Medicaid statutes. So that's phase two. We're not doing that here, but just putting that out there. So it starts off with some definitions. Most of them are new, but some have been moved from in the chapter. And so we have, for the first time, definitions across the whole chapter of covered individual, which is the person who's covered by the plan, healthcare services. And I know in some of the bills we've been working on this year, we've specifically been adding counseling, and I think that may make sense. So we may want to look at adding that in here just to make sure we're having a consistent definition. Health insurance plan. And so this is a policy or contract issued by a health insurer, including the plan offered by the state of Vermont to its employees, and any plan offered by an agency or instrumentality of the state to its employees. Unless otherwise specified, the term does not include Vermont Medicaid. We have the health insurer definition, the broad one, where we talk about the different types of entities that offer health insurance in this state, and also, to the extent permitted under federal law, a third-party administrator, an administrator of an insured, self-insured, or publicly funded healthcare plan offered by a public or private entity. We introduced the term major medical insurance because often that's what we're talking about, particularly in the benefit mandate section, subchapter. We're really looking at major medical. And so what's in and what's out of that. And then here's an example. So compliance with federal law, this is an existing law, is 4062C of Title 8. And the only change I made in this section is just to change coverage to plans. So that's where I'm trying to indicate what has actually changed from current law, so that the stakeholders and everyone else who's looking can tell. And as I said, for the most part, we're really just going through and cleaning up language for consistency, for best practices as far as current drafting style, for clarity, getting rid of a lot of legalese that's in here, trying to make the statutes a bit more readable. So for example, getting rid of thereunder and instead just saying health insurance plan and under the plan, and benefits payable under the plan instead of thereunder, a lot more accessible for the average person. So that is what is in this bill. And so again, sometimes it's moving things around in the section to make it make more sense, but there should be no substantive changes. And DFR and I were very clear that if they wanted to make any substantive policy proposal changes to the insurance statutes, they would do that in their DFR housekeeping bill, which is the one you looked at a little piece of on Medigap plans. So that's really, I don't know how much you want to go through this or just know what is there. As we get further into it, some of it is a little, well, that's actually the Medicare supplement stuff that may change, a little, more marked up just because some of these statutes have not been amended in many years. We did leave alone if I can find it. Yes, I'm actually in it right here. Did not make changes to the actual provisions of, go up again, sorry for the dizziness, of existing law on required standard and optional policy provisions. So we did make some changes in the intro language. But for the actual provisions themselves, DFR felt it was more appropriate to leave those provisions exactly as they are because they are the basis on which the insurers currently craft their plans, although I don't believe they actually have been required to use the specific language. And so in this piece, if you decide to pursue this bill, we will need an amendment because it was brought to my attention by our publisher that there's a couple of clauses that are actually missing from, I think, the version of the statutes that I was pulling from to put this language into the bill. And so we should add those back in, but they had to do with the standard policy provisions. I think they have been continuing to operate as they should. I will take you to the end. There is there's a number of conforming revisions in here where I just changed terminology and cross-references from, we're not there yet, from existing law. So still not there. All right, now we're in the conforming revision. So just as I updated the section numbers in this bill, we needed to update the references or delete obsolete references to repealed statutes. And while I was in some of these statutes, I was cleaning up language like rate therefore. So a couple of things to just flag as we get to the end here. One of them is just as from a timing standpoint, we are in my office, part of our responsibilities every year is statutory revision work, where we take all of the acts that you passed during the legislative session and work with the publisher to integrate them into the green books and the website to incorporate all of the changes you make to statute. Every year as part of that, we republish 4 volumes, 4 green books in their entirety, integrating their supplement, everything that's been passed since the last time the volume was republished, into what I call a shiny new green book. And this year we happen to be doing 8 VSA Part 1, which is where this chapter is. So this would be a great time, if you were going to take this bill up, it would be a great time to do it because we can get it all incorporated into the green book. All right, so a couple of things just to note here at the end. First, I added in at the end of this additional conforming revisions that when we are doing our statutory revision work, my office would be directed to update any additional cross-references that I missed. I tried to search pretty comprehensively, but if I missed any and they have the numbering scheme that was in effect prior to the effective date, we can update them to conform to the new numbering scheme, we should. And then we have interpretation and rule alignment. And this language here says that the purpose of the bill, as I said, is to update and reorganize the health insurance statutes. It expresses legislative intent that the technical amendments in this act shall not supersede substantive changes contained in other bills enacted by the General Assembly during the current biennium. The idea here is just because we're reorganizing, kind of updating language, if you're actually making changes to the statutes, like those Medicare supplement statutes we looked at, we don't want this bill to wipe out those changes because they were both enacted in the same time. So it would it would say, where possible, the amendments in this act shall be interpreted to be supplemental to other amendments made to the sections of 8 VSA Chapter 107 that were using the current numbering scheme. To the extent the provisions conflict, the substantive changes in other act take precedence over the technical changes in this act. Amendments to statutes in 8 VSA Chapter 107 that are enacted using the numbering scheme that existed prior to the effective date of this act, so the current one, during the 2025-26 biennium shall be codified in the corresponding statutes as renumbered by this act. In addition, rules adopted and orders, bulletins, forms, and guidance documents issued by the Department of Financial Regulation, the Green Mountain Care Board, and other state agencies that refer to statutes in 8 VSA Chapter 107 using the current numbering scheme shall continue to be valid following the effective date of this act until such time as the relevant documents can be amended or updated to align with the renumbering of that chapter by this act. So if DFR has rules on things that insurers have to do that are linked to the existing numbering scheme, it's not invalidating those rules just because they refer to the old numbering.
Or a form that might have.
Or a form,
something
exactly.
at the bottom.
And it would take effect on January 1st.
So just for my own sake of understanding these last couple sections, basically, if we do anything this year that references 8 VSA and it has a reference number, this gives you or the Office of Legislative Counsel the ability to actually change to the correct citation in this new chapter numbering.
Yes, exactly. That's what section 31 says. And, I think we had that authority anyway, but it can be helpful to direct us to do it just to be kind of a little bit more upfront about the fact that that work is going to be doing. But
And anything that we change in 8 VSA, that supersedes any language that we put in here because we're going to pass this language, any substantive change.
Exactly.
supersedes that.
exactly. So if you're actually making policy changes or you're making changes that are inconsistent with the way the reframed technical version of 8 VSA Chapter 107 looks, then it would default to the substantive policy change.
And you'll.
And that's
be
the
able to
work that I would
update
do.
The citations in that without having to do anything else.
Right.
Yeah, great.
Yes, and I could fit them into the numbering scheme, and there may be need to be a note in the green book. If it's just to make sure I try to leave, part of our statutory revision work is leaving breadcrumbs for a future researcher trying to figure out what happened, so that they can figure out the legislative history.
Leslie, did you have a question?
Yeah, I did. I mean, I'm just looking at section 32.
Yeah.
And it uses the word current. And I was wondering if that was a little vague because in the next biennium, that would be current. So later in the, you said 25, 26 biennium, and I just was wondering if that needed to be said there too, but you may think it's covered. I
I think it's covered because it would be a 2025 act with a January 1st, 2026
So it's
effective
connected
date.
that
So
way.
I think it is still a point in time. But yes, in general, I think particularly in statute, I try to stay away from using current because current is in the eye of
that
the
moment.
beholder. Yes.
Yeah. Thank you.
And January 1st of 26 gives you all the time you need to update.
Yes, and I think it's useful for, yes, it'll give us the time to do the actual updating, and I think it's useful for anybody using these statutes in their professional work to be able to just have that advance notice.
Looks like a lot of work.
Yeah.
That's a lot
I was
of
just
work.
like, oh my God.
Oh,
Thank
thank you.
The better part of a couple of months, I would say. It was really fun right up until it wasn't.
When you say we,
Down memory lane.
yeah, when you say we, is there more than you involved in this
In this
revision?
particular project or this
Yeah.
statutory revision work generally.
No, this.
For my office, it was just me.
Wow.
And then I had some great collaboration from some of our friends over at DFR.
Yeah, amazing work. Thank you.
Frequent
So
meetings.
did this come about through the Senate or who recommended?
Who recommended this? I would say DFR reached out to me about
Okay.
creating some greater consistency in a few sections. And I think I said, well, actually, I think it would make sense to, as long as we're doing it, let's really do it. And so then I reached out to the chairs and said, what would you think of sponsoring something like this?
Thank you.
Is there an 8? There's a.
There is, H95 is in here as well.
Forgot about that one.
Yes, I think Madam Chair.
Yes.
that version.
Um,
Yes, and they are.
full disclosure, I didn't read it before I approved it.
All 215 pages.
That's true. The markup version is even longer. The clean version is a mere 180.
All right, any other questions about this?
I'm happy to, go through any parts of it. I will say I received minimal feedback from the stakeholders it was sent to. I did get a couple of very specific requests or notes of things that were really helpful that I was just able to go in and fix. I think in one case, Blue Cross said, there's a reference in here, and I think it was franchise insurance or something. I don't think we do that anymore. And I checked with DFR and we don't, so we took it out. So some of them were very targeted, very specific comments that were great feedback. But in general, there was not, I was not sure if there would be a big outcry, but I did try to give, a couple of, at least a month before I asked for a response. I sent it out with a month to get comments and then send out another version with another reasonable length of time to provide comments.
I know oftentimes we will do bills and there will be a stray word or something that changes. I know that we often update more contemporary language, gender, things like that. Was there any, is this all consistent now with language? Was there any?
Yes, it should be. The only things that have not been updated to use non-gendered language, things like that, are those standard and optional policy provisions themselves that DFR recommended not changing because of the way they're implemented by the insurers. But yes, everything else, and that's a lot of what you'll see in the markup is trying to use language that is more current. Is just seeing, again, I think it's the same piece that we looked at in some of the Medigap stuff, but, reference to interactive television, I've updated to remote. Remote means, but a lot of it is really trying to get rid of some of the just inconsistencies in whether we refer to a health insurer or a carrier, whether we refer to a covered individual, a covered person, a beneficiary, a participant, a subscriber, a policyholder. I mean, the terms, we define healthcare professional differently in different places. There was just a lot of inconsistency and a lot of repetitive definitions that were always carving out the same things to make it apply to major medical. So now we have a definition of major medical. So yes, that's what a lot of what you'll see is. And then there are, as I said, a few sections that are just completely removed because they are no longer allowed under, either no longer relevant or no longer allowed under federal law, having to do, for example, with converting a group policy to an individual policy. That's no longer an option. Somebody enrolls in has a special enrollment period and enrolls in a plan.
Were there any CD-ROMs in here?
Floppy there.
I feel like there was. Was this a CD-ROM? Is that something else? We did have that somewhere. Oh, no, that was in Title 18.
Yeah, last year I remember we had to.
CD-ROM. No, but those are great examples of things that are just not how we do things, not how we say things anymore.
Great. No other questions?
Try not to make changes just for the sake of making changes.
So you have 2 suggested amendments to this and you have those flagged.
The pieces of language that are missing.
Yeah, you had one, but you had talked at the beginning that might need to be changed. As you were walking through, like even page 1 or 2, you said something that should be changed.
I have to look again because now I don't remember. Oh, yes, to add the word counseling in for healthcare services. Thank you.
Okay. All right.
Thank you.
The time for
Let me make a note.
Thank you. Fastest walkthrough on the longest bill ever.
Right. I mean, I recommend anybody who wants to or is having trouble sleeping, take a look through the full bill.
That's like,
I'm just wondering what our time frame is and how we want to move.
Well,
through
this is, it's an S bill,
Mhm.
so you have until the end of the session.
Yeah.
Although it does
That's
need to
our
go back over because we're going to make these amendments.
So it's going to take a while to go through the whole, maybe not, maybe
Up
it's,
to you. It was dealt with very quickly in Senate Finance.
okay, that's great.
I think it's been up there since about the first week. So.
Pack this one out.
And we want it in is it a shiny
New green.
shiny new green book.
Yes, I mean, I will say
This year.
the earlier you do it, the easier it will be in our work with the publisher to just incorporate these changes. And then, I'll have a bit of a project this summer, just making sure that I'm also tracking or, integrating, because I'm going to be doing a lot of the work of deciding which ones are substantive, or harmonizing where possible and deferring to really, it's just all of your other work for any other provisions.
Alan, did you?
No.
Oh, okay. All right, well, thanks, Jen.
Sure.
And thanks for all your work on this.
Well,
I guess we can go off of like, we're back at 10. We have guests at 10 o'clock.